Okay, so I am going to turn it over to Nick. I'm sure if you're on tonight, you know him from seeing his face out at conferences. He is director of sales. Is it director of sales at SureFit? Is that
Yeah.
right? So if you have any questions about product availability or pricing, you can refer to him and I'll share his email at the end. And without further ado, I'm going to turn it over to you, Nick. Take it away.
Awesome. Well, thank you everybody for spending part of your Wednesday with us talking mobile X-ray units. As if you've seen me on here before, I always try to promise two things. The first is that I will be informative, concise, and that this will not be an infomercial. The second is that I will leave time for Q&A, but I will also do my best to answer Q&A throughout the webinar, because these are a lot more fun when you all are engaged, and I want to help you, and you're spending part of your evening with us. So ask questions, and we'll get started here. So the caveat to the infomercial piece is I will spend 60 seconds telling you who I work for and what my background is. So hopefully you will understand that, what I'm talking about is both from experience, not only from the supplier or vendor side, but also from the practice side. So, um, on that note, for those who don't know, SureFit's actually part of the Hanger portfolio of companies. So we have two primary divisions under our umbrella. There's the patient care side, which probably everybody on this call has heard of. We operate over 1,000 practices nationwide, and you know them as Hanger clinics. What a lot of people don't realize is that there's also a whole products and services side of our company, which is what SureFit is part of, along with companies such as SureStep, SPS, PhilHour, and many other brands that are in the O&P and podiatry universe. So historically, many people knew SureFit as diabetic shoes and inserts, but given our supply chain and our purchasing power, and also just given the amount of practices we work with, both in podiatry, but also orthopedics and O&P, we have this enormous portfolio of products that includes DME, custom and non-custom bracing, and also diagnostic equipment. So we're going to talk tonight about the diagnostic equipment. As Ann mentioned, I've been in the podiatry world for about 15 years now. You've likely seen me at a conference or run away from me at a conference. Either way, I respect it. Um, but during the 15 years, I would say I was around when CR technology came out and the ScanX was all the rage for those who remember the ScanX technology, or maybe still even have it in your office and have been trying to find where you can get those replacement parts for it, or scouring the internet trying to find the pieces to keep those babies alive. But I've also had extensive experience working with brands ranging from TigerView to 2020, A2D2, Rayance, All Pro, Excel, Sigma, little bit of everything. I've seen dental x-rays converted to podiatry. I've seen portable x-rays for podiatry, orthopedics, multidisciplinary, veterinarian use, even most recently a pediatric urgent care. Um, but aside from just being on the vendor side of the fence and coming off as hopefully not just another sales rep, I also spent a number of years managing practices. So prior to coming to SureFit, I actually helped to manage over 80 podiatry offices in the United States. And I personally oversaw the x-ray upgrades and repairs at the site level. Um, for better or worse, this gave me a nice refresher course on how greasy salespeople can be sometimes. And I also got to experience firsthand how critical it is to have a really good relationship between your x-ray vendor and supplier and whoever manages the software, because those oftentimes are different people, as well as your practice, because there's no worse feeling than being shooting x-rays in the middle of the day, everything goes down and nobody answers the phone, or you call the person who sold it to you and they say, you got to call support. You call support, you find out support's in Korea and they don't answer the phone during business hours. And you're sitting there having to tell patients that you can't take x-rays and you got to reappoint them. None of that's fun. So now that I'm done with my little spiel here, I will jump into why you are spending your evening with us, which is to learn a little bit more about mobile x-rays and how they can improve efficiency, patient outcomes, but also what to look for if you're thinking about a mobile x-ray. The other thing I'll do, which often drives me nuts when I'm on a webinar, is I feel like people always want to avoid talking pricing because for whatever reason they think that it's like this huge secret, and if I tell you, you're going to figure something out that somebody else doesn't know. So I'll talk to you about pricing, costs, options, and configurations, because if you're looking at mobile x-ray, you potentially have a unique circumstance. Honestly, maybe you don't, and in more cases than not, it's a circumstance we've worked with before. But there might be a different configuration that fits your needs based off both your practice, where you want to see patients, but also potentially on the state and the rules and the guidelines. So I'll speak to that a bit as well, because that is different than your traditional x-ray guidelines. So hopping in here, the top two reasons I hear people tell me that they refer out x-rays are due to space and cost. There's a number of other reasons. I hear, hey, there's an imaging center across the hall from me. Patients walk over, then they walk back. We'll talk about some of that, but as it comes to the space conundrum, mobile x-ray really solves for that. Um, Pictures don't do it justice, but imagine this is the most popular podiatry mobile x-ray generator. And I'll talk to the difference between an x-ray generator and a panel, because those are two different pieces of equipment, and you require both to be able to really use this. But this almost, it looks like and it acts like one of those old school JVC camcorders. Probably the kind that somebody was smuggling into a Backstreet Boys concert back when I first went to that show. Um, but it really is that size, that weight, that easy to use compared to some of these historical, the Excel systems that are excellent. And we work with the brand new Excels, the brand new pod scans, a number of the systems. They are great, but they take up a lot more space. And realistically, you need a dedicated room or a dedicated area for them. I was trying to put this math kind of and take some of my stories to make this more realistic for you all. And, by my calculations, I've been in over 3,000 podiatry offices in the US, which means I travel way too much. But what I can tell you is at least 50% of the time I'm in an office, the dedicated x-ray room often is kind of a cubby in the back hallway. A lot of times it's the unused treatment room that doesn't quite have enough space for a full x-ray setup. And I saw a question come in, is the only model mobile x-ray? And I will say, yes, tonight we're mainly focused on mobile x-ray. I can speak to and take some questions on mini C-arms. But the bulk of the presentation will be mini x-ray, but I can certainly speak to the mini C-arms as well. In fact, I was about to reference those. But to my point of having walked through practices and seen practices, a lot of times the x-ray room ends up in that room that's not quite big enough to be a treatment room, and sometimes doubles as the storage room, the modality room, and the room that is very difficult to get somebody who's non-ambulatory into in a wheelchair. The last piece on this before I start showing you guys some examples and get into some more meat here is I am not a podiatrist. Take that for what it's worth, but having managed clinics all over the country and having managed both the operations, the marketing, the workflows, I can tell you from a practical standpoint, consumers want instant results. If they've made the decision, my foot hurts and it's driven me crazy enough that I'm making a doctor's appointment, they want to come in your office and feel like they're going to get an answer. They don't want to come in your office, be sent out for imaging and have to reappoint to tell them why they're in pain. So from a practice management standpoint, a consumer experience standpoint, I would tell you that if you don't have x-ray and space is the reason why you haven't done it yet, I would highly consider looking at mobile options. The reality is we live in an instant gratification age today. You order something on Amazon, it's at your house in 2 hours. You feel like you want your favorite restaurant, but don't want to leave your house. Uber delivers it in 45 minutes. They often get it wrong, but they deliver it. But this instant gratification age permeates to healthcare, and most people in pain want to get an answer when they walk in. So from a protocol standpoint, your patients expect to get imaging when their foot and ankle hurts, and it would worry them if they did not. So I'll talk more about this, but what I would encourage you is you should have practice protocols built around, I take x-rays for all of these conditions every time. That creates continuity of care, it reduces liability, it improves your treatment plans and consistency, and understandably, it will provide a reasonable return on investment for your practice. I say this on webinars a lot, but private practice is not Doctors Without Borders. For your practice to keep the lights on, for you to be able to treat patients, and you have to have both an obligation to provide great outcomes, you have to have a standard of care, but you have to generate income. And there's nothing immoral about that last statement. So in some of the later slides, I'll talk about the financials around how do you measure return on investment. So as far as like the most commonly used portable X-ray, and I know there's a question about mini C-arm. Obviously, C-arm can do uh, it can take images like an X-ray, but it also has higher billable codes because it's fluoroscopy, although it varies state to state and by your insurance coverage and other factors, whether or not you're going to be reimbursed on that. But the most commonly used mobile X-ray system is this one on the right. And a couple things I'll just point out with it is this stand is optional. A lot of states do require the stand for your inspection. I see people using it on the stand and off the stand all the time. But this is the X-ray generator. This is the mobile stand that folds up. It can also have a laptop tray if you want to have a laptop right there. This is your panel. The panel is different. The digital panel is different from the X-ray itself. That's a separate modality. It's a more expensive modality. Um, Over it, what we always recommend, while the panel comes in an encasement, the panel is the more expensive piece. So if you're sticking a patient right on there, over time, you're asking to have potential issues. So we always do an acrylic weight-bearing cap that almost acts as a little protective stand for the patient to shuffle onto right there. But what this also does is it helps qualify you for the ADA tax credit. To be clear, there are portable X-rays though of all types. And I'm going to show you a photo of another one shortly. There's also excellent mini C-arm options. Later in the Q&A, I can speak to like the Turner mini C-arm, which advertises a lot in PM News, and that we are also a dealer of. Portable X-ray though can vary in cost from call it $12,000 to $75,000. I'd tell you the mini C-arms, generally speaking, are on the higher end of that. But I was recently at a trade show with a new mobile X-ray solution, and I was really excited about it. And I found out it was about $45,000 for just the X-ray, not inclusive of the panel, and it was not a C-arm. And my general takeaway is that for podiatry, the economics don't support that. For your practice, it could very much support a mini C-arm potentially, an extremity focused C-arm, but just a straight mobile X-ray. If you're looking at something that's $30,000 or $40,000 for standard X-rays that you're going to get reimbursed about $30 to $25 for every 3 images per extremity, that's a tough one to make the ROI work on. One other key call out that I'll speak more to later, though, is the mobile X-ray rules do vary state to state. This device is approved in about 45 states, including DC, I believe now. But I've seen very weird circumstances, and a good example is New York State versus New York City. I'm not sure if they can agree on the time of day, but they don't agree on their X-ray rules. So while the state has one set of rules, New York City ignores those rules and has their own rules. So I've seen instances there where it can vary, and I'll talk more about that as we go. So another great use of mobile technology, and this came up with a client recently, was they have a lot of non-ambulatory patients. They have a lot of patients that are being brought in from nursing homes in wheelchairs, sometimes even in gurneys. If this is a concern for you, back to that comment of trying to get a wheelchair to the back of your office or down a narrow hall, spin it around, then the flexibility and the safety of doing a mobile x-ray where they can stay seated potentially. Obviously, you want them weight bearing, but if they can stay seated if necessary or still laying down, mobile x-ray gives you a lot more risk to cut down on fall risk prevention. And I've been in offices where I've seen, to their credit, like very creative use of hand-built guardrails, using old guardrails from x-rays that are no longer even sold anymore. And that can work and that can help. But if you don't have the room to easily pivot the wheelchair in that space, then a mobile x-ray might be a really good fit for you. And it still qualifies for, as I said, the ADA and the Section 179. So this is an example actually of a different mobile x-ray system. Again, I wanted to give you all some real examples. I recently did this install with a multi-specialty practice. They had a podiatrist, but they also had an orthopedist. They had a couple other doctors that they wanted to be able to get different types of images, and obviously an Excel x-ray or even the portable I showed before wasn't powerful enough. So we did what's called a scan mobile system here, and they got a couple different panels. They got one panel, an extra large panel that they can actually wall mount as well. So it came with some mounting stands. So if they needed to take a chest x-ray, they could even do that. So I bring this up because I talked to doctors. I was talking to one out at the Western actually this past June who was in a multi-specialty practice, and they were trying to find an x-ray that fit everybody's needs, but that wasn't going to take up the size of, like an orthopedic imaging center. So this is a good example of, if you're in a multi-specialty practice, certainly talk to somebody, talk to us, and we can show you different options. A big advantage of mobile x-ray, and specifically the podiatry one I was showing, but also C-arms, is the lead shielding requirements. State to state, the lead shielding requirements can vary wildly. So if you're in an office and it wasn't built out for x-ray, or you're subletting an office, or you're even part-time at an office that doesn't have podiatry x-ray, a lot of times you don't want to deal with the potential cost of building out x-ray shielding, because it's both expensive, it's challenging, it's not going to return on your investment if you're leaving soon or if you're not there full time. So the beauty with mobile x-ray is that the requirements are far lower. On average, patients receive 1/7 of the radiation, 1/7 less radiation than traditional wall-mounted x-rays. And in general, the overall requirements state to state are far lower on mobile, because really dentists are one of the biggest users of mobile x-ray. When you think about dental x-rays swinging in on an arm for your face, those are similar technology. A lot of these companies also do dental mobile technology, mobile x-ray technology. So because of that, the requirements are a lot different, and it's to your benefit if that's a concern. We work with a lot of consultants. You've heard my background. I feel like I know what I'm talking about, but I'll be the first to tell you there's a lot I don't know. And there's a lot I'm never going to know because there are too many rules in too many states. So we work with some great professionals, some great consultants. Greg Turner's an example of one who he works for Tigerview Televere, but he also has his own radiology coach consulting business. He has some great videos on YouTube if you want to look up the radiology coach. But the key to this goes back to what I said early on, which is you're looking for a partner and not somebody who's going to sell you the car and then never take your call again. So if you're thinking about making an investment in X-ray, it's good to know that you're going to have resources you can work with to find out your exact state, city, county requirements, and who are going to make sure that when you make the purchase, all the registrations get done correctly and all the nuances for your state are known ahead of time. Because some states require that stand, some don't. And if you're going to get an inspection and your state requires a scan and you didn't get it, you're going to call up your rep extremely angry that they didn't tell you that, feeling like you have to pay a surprise extra, call it $2,000 that you weren't planning for after the fact because you failed an x-ray inspection. will help you avoid that. So another reason why I think mobile x-ray though has picked up steam, even in offices that have plenty of space for traditional x-ray, I see a lot of younger doctors opting for mobile because it looks techy. It looks forward. It looks very, even though it's a little JVC, when you see it on the stand and you have a wall-mounted monitor and the patient's not having to go back to a different room, gives the practice the reputation of being technology forward. A lot of times what I'll see practices do, you got to have standardized protocols. I would always advise show your patient the image. It'll pop up instantly. If you do a mobile system, you can have a laptop right there on the tray or have a wall-mounted monitor, but you can pull the image up. The software allows you to show measurements, to make edits, to inverse the colors, but you can point to exactly what's going on with them. Back to that comment of instant gratification. People want to know what's going on. Everything you say after you show them the x-ray is going to build that trust. But if you don't show them the x-ray or you don't take the x-ray and you say, hey, I recommend we do this, this, and this, a lot of times they're going to go, okay, let me think about it. I'll get back to you because they're going to go get a second opinion. What I would say, a trick I used to hear Hal Ornstein back in the day at PPM shows always talk about was that he would print out every x-ray. So he'd do inverted color so it didn't waste that much ink. He'd print it out on his practice letterhead and he'd give it to every patient when they left because he said the number one thing he found was people hung it up on their fridge at home. And when other people came over, looked at it, they always saw his practice logo in the x-ray, and he got a ton of referrals that way. Another thing I'd call out though is having x-ray is something you want to advertise. It should be on your website that you offer x-ray. You should let your referral sources know, hey, these are the conditions we treat. We have x-ray in-house. We have very modern mobile technology. You can put images on Google, social media. So an example I have here was this pediatric urgent care. I actually help do an install for about 3 weeks ago. They got their unit installed on the 24th. They went live with it the 30th. They decided to put up some signage. They put it on their Facebook. They reported to me as of Friday that they've gotten an average of 2 to 3 calls a day from people saying that they saw the clinic offers x-ray. They wanted to confirm they did have it before they came in for an appointment. But they've been astounded as to how many more just appointments they got by not only marketing and advertising it, um, but by just having it as an option because it gave people reassurance not to go somewhere else. Another example from this, and part of why they chose mobile, aside from space constraints and honestly lead requirements, was that sometimes if you have a lot of pediatrics, just like non-ambulatory patients, pediatrics can be challenging to get to stand still, and they found it was easier. Like they could have the child standing or sitting and their parents standing behind them. They got aprons for both the adult and the children, but they could then go point the x-ray and it was a lot easier and a lot less intimidating for children to get an x-ray. They didn't get taken off to a different room. It wasn't quite as scary. I have a 4-year-old and a 6-year-old. They've both broken multiple bones, so I can very much relate to that experience of, my son being panicked the first time he was taken back to an x-ray room and he was told he had to go alone. So one of the most obvious reasons before I get into the financials here, and I told you I promised I'd try to be fast, so I'm wrapping up here. I have two more slides really, is that it's obviously flexible and portable. So I say flexible because depending on your practice situation, if you have a lot of satellite offices, if you are in a sublet and you're not sure you want to buy an x-ray and then have to move it, or if you um, work between multiple offices that don't have a dedicated podiatry x-ray, this gives you options. Yeah, the stand isn't easy to transport, but the actual mobile x-ray, the panel, and the laptop can go in your back seat and it doesn't weigh a ton. In fact, we recently just did some installations for Western University for them to be able to use portably with some of their satellite offices. I've done installs in everywhere from San Diego and LA to Charlotte and Chicago this year, down in Texas as well. So mobile is just a really practical tool if you are not in your forever space and you don't, or if you just don't have that space, but you also want to travel other places. So I think it's a very good tool to look at. Sometimes if you're in a space where traditional X-ray fits and you got a spot for it, easy for patients to access, this is, I will say a benefit to a traditional X-ray is for the X-ray system itself, it's a longer warranty. You get 5-year warranty versus most portable X-rays are 1-year warranties. Also, you're not dealing with batteries. Mobile X-rays have batteries. Yes, they have good life. You can get extra batteries, but anything with a battery, ultimately the batteries die, you replace them. Um, but for a lot of people, the mobile X-ray ends up being a great setup. So if you're looking at the mobile X-ray, I would say the actual handheld is under $12,000, called 11.5. The stand is somewhere between $1,700 and $2,000. It's not required. Some states require it. I've had doctors tell me they don't care and they don't want it. I have a lot who want it though. Um, the panel is usually the most expensive piece. So if you have a panel already that's wireless, you don't need a new panel. But if you don't have a wireless Wi-Fi panel, this is the most expensive piece. Typically, these are going to run you, depending on warranty, anywhere from, call it $17,000 to $20,000. That's the more expensive component. All in though, you're typically around $33,000 if you need everything. And that's prior to taxes or and financing if you opt to finance it, which I'll talk about. I would say though that if you already have a panel, then you're really looking at an investment of 12 to 14K to go mobile. And it includes the software, the laptop, or if you want a PC because you're going to use it in one room mainly, it includes the ADA compliant acrylic step, installation, and on-site training. Some of the additional options, I see doctors get Pelican cases if they're going to travel to multiple offices. Pelican cases are highly durable, unbelievable products. They're heavier, but a lot of times people say if I'm going to be taking this from office to office, I kind of want to feel like it's protected and I'm not going to run the risk of dropping it. And if I drop it, it'll be just fine. I also see people opt for different warranties. You can do different extended warranties or warranty lengths based off the panel and on the ADX. I also will see people get a larger panel size. So the larger 14 by 17 is a wider field of view. Potentially, if you're doing multi-specialty, you want a larger panel size. And then most people will get an extra battery. That's a couple $100. But those are some of the different things that go into into the costs on this unit. I often hear the expression, you need to treat the patient and not their wallet. A lot of times I'll hear people say, well, patients don't want to pay for that. Patients are coming to you because they want to get better. And if you tell them that you're going to give them the best treatment plan by having an image, nobody's going to balk at the average $30 reimbursement you're getting here. And it really is something that can return on your investment pretty quickly. So I'm going to talk through that, the financials on that. But what I would say is if you're thinking about doing an X-ray, it's kind of like a real estate agent. If you've ever bought a house, looked at a house, even gotten a rental with an agent, there are good agents, there are bad agents, and then there's do it yourself online. All of them can work depending on how much of your time you want to spend on it, what your patience tolerance is for surprises and oopsies and, oh, I forgot about that. So what I would just say is do your homework, just like if you were buying a house. Make sure you're working with somebody who's getting you all the requirements for your area before you make an investment, because if you're going all in and it's 33K and you're potentially financing it, it's like buying a car. So, make sure you do your homework. Don't just go for the thing you find on .med that is cheap and used and it says it works like brand new, because you will get it. The software will not work. If the device doesn't work, there will be no warranty. there's a lot of challenges with the dot med route. So to the return on investment piece, and this was really popular on the last webinar, uh, there is a very easy to use ROI finance calculator we can provide you with. It can help you understand what would your monthly financing look like? How could you cost it out? One of our finance partner has both 6 month and 12 month deferred payment options, where you just do $99 touch payments for the first 6 months or 12 months, and then you go into a payment plan. You can also play with the reimbursement. So I always tell people you can listen to me give you averages, but before you buy an x-ray, if you don't have one, reach out to your payers and confirm what your reimbursement's going to be. Confirm it's on contract. It should be, but confirm that, and then you can play with the numbers yourself. I oftentimes like to use the average of $30 per patient. Let's say you're going to take 5 patients' x-rays a day, and that's for, we're just saying unilateral, not bilateral here. 5 days a week, you work about 4 weeks a month, 11 months a year, because you take a month of PTO. Comes out to about $33,000. If you're financing that and your payment is about $700, you're netting about $2,300. Could you just buy it outright, pay it off in year one, and then it's debt free and owned? Absolutely. We certainly, unlike the car dealer who tries to push you into leasing because they know you'll be back in 3 years, we want you to do what financially makes the most sense for you. Our job's to show you options. So one of the things we can help you with is you can get a risk-free financing assessment. It does not do a hard credit pull. It has no impact on your credit score, but they can tell you what your rates would be and what your options are. Typically with leases, the way this works, and people, it didn't used to be this way, but it's way more so now. Most leases don't let you do an early buyout until you're 12 months in. After 12 months, most leases will let you buy it out, and then you can save on a bunch of interest down the road. But you want to make sure when you're looking at finance options to find out what your buyout options are, because they might give you what looks like a great rate, but you've paid the device off in 14 months. You're ready to pay it off, and you discover you cannot pay it off early. You are locked into that interest payment, and you have to pay it off over the term of your loan. So just that's a good question to ask. It's also good, aside from just our finance partners, if you have a relationship with your local bank. I recently had a customer who used their American Express, did a loan for them at a very low interest rate. So your credit card companies are doing a lot of buy now, pay later stuff. There are options for financing. Just make sure you're asking all the questions and figuring out what your buyback or payoff options are so you're not surprised. Another thing I'll throw out here is if you're financing, they're going to require you have insurance on the device. So you should be able to add it to your policy right away. But if you finance and 3 months in, you haven't added it to your policy, you're going to probably call me or call the finance company and say, what's this extra charge I'm getting every month? What that is if you don't prove to them that you've insured the device, they're going to charge you insurance for it. Because if a flood happens or if Mrs. Jones drives her car through the front of your office, unfortunately, and it takes out the x-ray, they want to make sure they have insurance on it. So that is another factor to consider that I feel like a lot of people kind of gloss over or don't mention until you're frustrated as to why you're getting a surprise bill from a finance company. I'm going to pause there and pull back up the question since I got booted out. Can I explain what ADA and Section 179 are? Absolutely. So I believe I'm still sharing my screen. So the ADA is the American Disability Act. ADA gives a tax credit for putting in equipment or accessible items into your office. I will always tell you to check with your accountant. I did not stay at a Holiday Inn Express, and I'm not going to pretend to be one, but I believe off the top of my head, it's something in the realm of at least a $5,000 ADA tax credit you can get every year. And I will verify that and send that out as a follow-up. But the ADA tax credit essentially helps. So you pay for this device, you can apply the ADA tax credit to your taxes for the end of the year. It helps offset the cost. It's a accounting move that essentially nets you a savings of that amount. The Section 179 is a section that you'll hear every capital rep for anything you ever buy talk about every year, because over the years they have talked about doing away with Section 179 tax savings. But what that is it's essentially a program that allows you to deduct certain investments in your business that are capital expenditures against your taxes. And it has a much higher dollar cap. But if you meet with your accountant and discuss Section 179, typically I always find, not always, but usually, the accountant will agree that this is a 179 deductible item. It's an capital expenditure investment. Even if you're financing it, it still should be. And it's another way that you can essentially offset the cost of what you're forking out or financing up front. So it is a tax benefit to consult with your consultant or with your tax accountant on. But it's a good one, and it's something you'll hear used by reps all the time. Okay, so I've got a couple questions I'm going to flip to. Is this the only model X-ray? Yeah, we discussed that. Hi, my office is in New Jersey and Pennsylvania. Is this mobile X-ray compliant? That is a good question, and I anticipated I would get some of this question, so I cheated and just pulled up a list. I had a list ready for me. Let me get to New Jersey. Love doing this live. I will check on New Jersey because I don't see it. Pennsylvania, I know it's approved. I will double check New Jersey, but Pennsylvania I have on my list. My list is a couple years old already, but I will double check this and I can follow up with you on that. Okay, so I see a question here. Will our wireless cassette with TigerView work with this? So if you have a wireless panel, and if this is Dr. Moore in North Carolina, I believe we did a wireless panel for you just last year. I can tell you that yes, you could use your existing wireless panel and just add the mobile X-ray, and then you could use that same panel and it could work with your existing computer as well. We could include a laptop or a second acquisition computer, but if you want to have your X-ray room and then have a mobile to bring out to patients who are less or non-ambulatory, I believe we could have that all running with the same panel and with your existing computer and setup. So your cost would just be adding the mobile X-ray. So I could certainly follow up with you on that. I had a question around mobile C-arms. Mobile C-arms they're a cool device. I think there's not many that are built for podiatry the way the Turner Imaging one is. And I'm going to cheat here and I'll just pull up our site. If you're interested in mobile X-ray, or I would say if you are interested, surefitlab.com, under solutions, imaging therapy, podiatry portable, and mobile C-arms. The Smart C is a really cool device. It is very small. It has a similar Pelican-like case. It has a optional stand. Similarly, it is a great device. From a cost standpoint, it's higher dollar. I'd say it's more towards, and they're running some specials now, so I'll confirm, but I typically see it in that 65 to 75K range. So that's something that you could potentially implement into your practice. So I can certainly follow up with more detail there. I've had great feedback on the device. I will say when we have it at trade shows, it's the number one thing people want to come up to our booth and talk to us about. About 95 out of 100 times, though, people decide that for the cost, they're just going to stick to X-ray or what they're doing. But the two things that probably get the most conversation at our booth when we have them are the Mobile C and the ADX handheld X-ray, because everybody walks up and goes, "Man, that's it? It's that small? My Excel could eat that." And they really are that portable. So I saw a question here. What is the device that looks like the RCA vid recorder? Yeah, so that is right on our site. It's a Dex Cohen's the manufacturer, but the software and all of the tools that come with it are through Televere TigerView, and they are the podiatry kind of arm of Dex Cohen, and we are one of their preferred distributors. So I will pull that up here if you're on our website and do want to look. It is made by the Dex Cohen. I can certainly provide spec sheets as well, following the call to anybody interested, so you can kind of see how it all looks and how it works, what the actual capabilities and technical specifications are. Again, I can always give them to you and have you speak to our certified radiology experts. I'll also be the first to tell you, though, that I know what I know. And if we want to get highly technical on this, that's when I bring in an expert. Okay. I'm going to switch back to Q&A. How do you know if you already have the equipment, which you described as the most expensive part of the X-ray, the wireless panel? Great question. So, simplest way, if you're not sure, I'd tell you, I'm going to flash back to here. Take a photo of what you have, take a photo of the panel, take a photo of it'll have a serial number. You might have to take it out of your case, the panel encasement. Take a photo of the serial number. You can text the photo to me. I kid you not, my cell phone is filled with photos of podiatry closets and x-rays, or you can email the photo to me and just put my email again in here. That's one way. Another way I can tell you you can know is you'll know if your panel is wireless because if you have a traditional x-ray setup, getting to a photo here to kind of help, and this is actually not the best one, so let me show one other. You'll see if there's a wire coming out of your x-ray. So if your panel has a wire running between it and your Excel unit, it's not wireless. If you can take your panel out and there's no wire to it, it's likely Wi-Fi and wireless. That's another easy way to know. Any other questions I can answer here?
Looks like you got them all. And again, like this was a very interactive session. We had tons of questions. After the last one, my favorite thing that Nick shared was that ROI calculator. So if you guys want to check that out for yourself, I'm pretty sure you can just email Nick and he can get that over to you and work with you to run those numbers and everything using that handy dandy tool.
Absolutely. Yeah,
Um,
that's a good tool, and that doesn't link to us unless you want it to, so you can just use it, never call me again. That's okay.
so any final thoughts on mobile x-ray that you thought while you were giving your presentation that you should have included?
Look, mobile x-ray is not for everyone. A lot of times people look at it because it's cool and it's different, but it may not be the right fit for your practice. But I'll also say the counter to that is it's amazing how many practices we've worked with who said, I thought I'd never be able to have x-ray in my office. I didn't know this existed. It is so awesome to be able to shoot x-rays now in the office with the mobile and to have patients tell me that, hey, I came back because I was frustrating, I wasn't getting an x-ray. So I think it's a great tool. Like any tool, though, you got to know what your patient load is, know what your return on investment can look like. And you also want to make sure, though, you just pick a partner or a vendor who's going to answer the phone.
Yeah, for sure. Um, so where can we see SureFit at conferences coming up in the next few months? We're in the middle of the busy conference season. So where can we see you guys?
I believe our next show will be at the AAPPM Lago Mar, and then we will be at New York, SAM, ACFAS. We'll be on the road show as always. I believe, some of the people on this chat even just saw us at ACFAB or at the Balance Health Summit. We will be all over, but I believe our next show is Lagomar, a PPM. We will have a representative, but not a booth, I believe, at the Region 1 show in the Northeast. So if you want to get connected with a rep there while you're there, certainly just drop me an email and I can put you in touch with our rep who's going to be at that.
Awesome. Well, it looks like, oh wait, there's something in Q&A. Hang on, let me look. Oh, great info. Thank you. So it looks like we've answered all of our questions in Q&A and in chat. If you guys have any follow-up questions for Nick, go ahead and email him directly, or of course you can text him if you've got his number. And if you would prefer to email me, I can forward your message along. And we will see Nick again very soon. Thank you,
Thank
Nick.
you
Thanks
all.
everybody for being here tonight on a Wednesday. I appreciate your time, and we'll see you next time.
See you next time. Thank you.